Hi guys, it's Dr. Richard Mills. Thank you for stopping by my YouTube channel and my page. Today I want to discuss an issue that I see in what I treat. I'm a sex therapist here in New York City that treats individuals with sexual dysfunction and also paraphilias. It's not the only thing I do, but oftentimes that is what I'm treating. Many of the guys will come into me and I'll ask them, the first question I get in intake, and one of the questions I ask them is, have they been in therapy before? And 9 times out of 10, they'll say, no, this is the first time I had ever went to therapy. I ask them about their history. They'll tell me that they've went to a urologist and that they were prescribed ED medications such as Cialis or Viagra. For my guys who have rapid ejaculation, one of the issues they tell me is that when they go see the urologist, immediately they're prescribed an SSRI. But they find that once they've adjusted to the medication, while it works, they find it really hard to deal with the issue that they can't either maintain an erection or they have issues of rapid ejaculation. So I will ask them, I'll say, hey, so have you seen a therapist before? And they'll say, no, this is the first time. One of the issues that we really see when dealing with sexual dysfunction, specifically things like ED, is that it's 9 times out of 10 neurological or psychological. Meaning that there's some anxiety performance around sex. So I'll inquire about their masturbation practices. Do they masturbate? Are they able to maintain an erection while they masturbate? And they'll say, yes, I have no problem with that. And then they'll go on to explain that they have a real difficulty maintaining an erection during intercourse. And so one of the things that I do is I work with my patients to deal with the anxiety performance around sex. So a lot of times, specifically guys, we don't really talk about things that are going on. We don't talk about with our friends, our guy friends, hey, yo, I'm having this problem. A lot of times they've never talked to anybody, and I'm generally the first person that they've talked to. And so one of the things, yes, the pills do work. I'm not discounting the pills. But one of the things is the symptoms need to be resolved in order for you to have a healthy sexual life. And so I'll inquire things like, what are their experiences with sex? I'll take a sexual history. I'll look at porn, what type of porn they watch. And just because somebody watches porn doesn't mean that they're going to have erectile dysfunction or rapid ejaculation. Oftentimes what I see with my guys who have rapid ejaculation is that they say when they were younger, they didn't have any privacy, and so they were ejaculating very quickly. Whereas a lot of times I see my guys that have ED issues and they say, I didn't have any privacy. And so a lot of times when we look at sex is a part of who we are. And it's really important that we understand that there's so many components to sex and what it means to be a good lover and how do we kind of address that. So I work with my clients to really understand the issues behind the anxiety. And really what we see in this world is that those people are looking for relief from the symptoms. So sometimes I'll see in about 5 to 8 sessions, I'll generally see the symptoms, I'll see them resolve. And then my clients generally stay with me because they start to see the value and understanding this is a safe space where they can talk. We really need to provide safe spaces for men, because the thing is that there aren't a lot of spaces where men can get in touch with themselves. And it's very true. And the majority of people that I treat are men. And they find that this is the place in therapy where they can process the things that have been going on. So if you're having issues related to sexual dysfunction, I would encourage you to reach out to somebody who is qualified to deal with, qualified as a sex therapist. That means that they went through the training, they understand how to treat it, and they understand how to help you develop an identity and an understanding of what it means to have a healthy sex life. So often I'll see people, a lot of people say that they're sex therapists or they do sex therapy, but they don't really necessarily know how to treat things like ED or PE. In addition, I see people who come into couples therapy. So I'll see either there's a diminished lower desire, so a hyposexual desire disorder, and then or people are very hypersexualized. And I'm going to talk about that in another video. The type of work that I do when I'm working with my couples who are in therapy together, and how does their couples therapy work, and how do we become effective and use time in couples therapy. And that's a later discussion that I'm going to put up. But for guys that are really, if you're struggling with ED, it's really important to understand, or PE or low sexual desire, to really look at how do we become, and how do we understand, how do we work together to resolve the symptoms. Because 9 times out of 10, it's anxiety that is really the central focus. So I hope that this has helped. Feel free to share with somebody that you know, or direct them to the page. I'm going to put my website down there. It's www.richardmillstherapy.com, and so you can chat with me in the comments page, or send me an email directly. All right, well, I will talk to you later. Take care of yourself and have a good day. Bye.